While they may not know about it, everybody's talking about it because of the pandemic. And that's our health care. And how much money do we spend on health care? So you're so right. Number one is education. Last year, our total expenditure in our budget was a little over $7.8 billion. And when we look at the Health and Human Services Subcommittee, it makes up 31% of the total budget. And so that was about $2.3 billion for FY21. And that's a lot of money. But 20%, and that's about $1.5 billion, specifically is spent in the Healthcare Authority, the Department of Mental Health, the Department of Health, the Department of Veterans Affairs, the University Hospital Authority, which is OU, OSUMA, which is OSU, and J.D. McCarty. And so I want to break those down just a little bit today so folks can maybe get a little bit of understanding. So for the Healthcare Authority, and they process the Medicare, Medicaid, Oklahoma taxpayer dollars is a little over $1 billion. It comes out of $1,039,368 to be exact. Now we leverage that against federal funds, and we pick up another $5 billion from the feds. And that kind of comes and goes, but it's right in that neighborhood. And so we spend about $6 billion a year in Oklahoma through the Healthcare Authority. And so whenever we break that down, how many people are we serving? Well, in August 2020, the enrollment was 893,262 people. Of that number, 35% were adults, 65% were children. So that's 308,935 adults and 584,327 children. And that's very important for the state of Oklahoma as we're reaching out and we're helping those families. Now, this is an all-time high figure and has seen an increase of 111,000 people this year. And when the pandemic is here or people are laid off work, they need services by the state. And so we've increased that by 111,000 people. 926,984 Oklahomans have received services from the Healthcare Authority since July. That's approximately 23% of the state's total population. That's a lot of folks. And so they're depending on the Healthcare Authority, and they're doing a great job at the Healthcare Authority meeting the needs of the people. Now we also spend about $334.9 million a year just on mental health. And again, there's some federal dollars that are leveraged, but these are services that says we need to make sure Oklahomans are taken care of. And you're very well aware that mental health's in the news. I mean, whether that be for the folks or the pandemic or our public safety, wherever it is, we're talking mental health. So right now, we find through the Department of Mental Health that 196,932 Oklahomans were served by this agency last fiscal year. And so we have 31,791 for substance abuse, 182,158 for mental health services. And so they're doing a great job at mental health, reaching out, trying to help folks. This is an area that we look forward to the next year's budget. You're going to hear quite a bit about as we examine mental health. Health Department's been in the news. And of course, they also leverage federal funds. They're doing a lot of testing. There's a lot of programs going on, and their funding is some at the county level, but I only want to talk about some of the state level funding and not the county nor the federal. And so they have a budget that we taxpayer dollars of about $57.8 million a year. Now, the others that I talked about this morning, like OSU and OU, up until a couple of years ago, there was federal money came in by 1152 waiver that allowed us to use some Medicaid dollars to train our residents. That's no longer the case. And now then we pick that up. And so whenever that we look at OSU or OSUMA, we spent $45,488,996, and they filled 352 residence slots. And then for OU, $66,691,554, and they filled 759 slots. This is very important for healthcare in Oklahoma because where doctors are trained is usually where they practice. We want them trained in Oklahoma, but this is now a total taxpayer expense on the state of Oklahoma. Now, if you add those up, that's a little over $100 million that a few years ago we didn't have to pay, and now we are paying that. We have 7 veterans centers in Oklahoma through the Department of Veterans Affairs. And we spend about $33.3 million a year on those veteran centers. The last thing I'll bring up today is the J.D. McCarthy Center. They do great work. 7,734 children with disabilities were served in fiscal year 20, and that's about $4.7 million that we spend. The state is really in great shape, I think, with J.D. McCarthy. They do great work, but yet we need to continue to fund them. Again, it's over 7,000 children that are served. Many of the health services that we do are children-oriented, which is great. But as we look forward to next year, we've got a new challenge before us. People of Oklahoma voted to expand Medicaid, and bringing in federal dollars is a great thing. We want to be sure people are healthy, but as Appropriations Chair, I'm looking, how will we pay for that? And so we have a minimum of $164 million to maybe as much as $246 million. That's going to be the state's share to match the federal matching funds for expanding Medicaid. The question is going to be, how will we deal with that the next legislative session? It will be an additional expense to what we talked about today. We don't want to cut any of these expenses. And so we're looking at now, how do we come up with and add another expenditure around $200 million to healthcare? So that's going to be our challenge for the next session. Thank you for dropping by. Good to see you.